Over 60% of Indians do not have their diabetes under control. Only 1 in 3 Indians with diabetes have an acceptable level of blood sugar. More so, half of those who have blood pressure with their diabetes do not have their blood pressure under control, and almost 6 out of 10 who have diabetes and cholesterol are not able to control their cholesterol either. And what is even more startling is that currently only close to 8% of Indians who suffer from all 3 of these diseases, diabetes, blood pressure and cholesterol together, have managed to control all 3 conditions, which means over 90% of Indians who suffer from all 3 of these diseases that I just mentioned, diabetes, blood pressure and cholesterol, has at least one of them out of their control. Yes, these stats are startling and from none other than an extensive study carried out by the Indian Council of Medical Research, or the ICMR, which is a part of the government's Ministry of Health and Family Welfare. This extensive study included over 1 lakh individuals across India for over a decade, from October 2008 concluding in December 2020, and was published in the globally renowned medical journal Lancet in April 2022. The study, which had 70% of its participants from rural areas and the remaining 30% from urban areas, indicated that majority of diabetics did not follow important lifestyle parameters either. For example, majority of the diabetics who took insulin did not monitor their sugar levels at home. 80% of diabetics did not eat the recommended 3 portions of fruit or vegetables a day, and 75% did not exercise enough either. The study also indicated that those with a higher education, males, and who had diabetes for 10 years or less, which is a shorter duration, are more likely to control their conditions. That means the bigger problem of controlling these chronic diseases is more amongst the female population, those with diabetes for more than a decade, and who are less educated. Lastly, this decade-long study by ICMR concluded that treatment targets and adoption of healthy behaviors when it comes to managing diabetes and other conditions such as blood pressure and cholesterol is suboptimal. More so, the statistics could have been even more startling, as it did not capture those whose diabetes was not diagnosed. It did not capture those who did not, for example, even understand that they had diabetes or either of the other conditions, and lastly, had poor access to healthcare.